Hello, everyone. Can you hear me?
Yes, we are hearing.
Thank you. So we are back
Yes, I can
from,
hear you.
thank you, Professor Bala. We are back from breakfast and we're going to be diving into the second panel for this morning. And once again, would like to acknowledge and appreciate all our partners, collaborators who made this possible. So I'm going to be introducing Professor Bala, which is a great pleasure for me to do. Professor Bala is going to Sorry. So Professor Bala is going to deliver a keynote address under the topic Smarter Surgeries, the role of artificial intelligence in robotic surgery. This is such a timely topic considering the advent of artificial intelligence in various fields of medicine, particularly surgery. So Professor Bhavneet Bhalla is a consultant laparoscopic, robotic and bariatric surgeon and gastrointestinal endoscopist with affiliations to multiple scientific societies. He serves as director of the World Laparoscopy Hospital, the associate editor of the World Journal of Laparoscopic Surgery, and chief coordinator of TUGSS endoscopy. He is also a member of the education committee of the Robotic Global Surgical Society, TROX, contributing to advancing surgical education and the integration of artificial intelligence in robotic surgery. Ladies and gentlemen, kindly welcome Professor Bhavneet Bhalla. Over to you, Professor, for your keynote speech.
Thank you, Samuel. Thank you for the kind introduction. I hope my slides are visible.
Yes, we can see your slides.
Just give me a second. I want to go full screen with this. Okay. Are they visible now? Am I audible clearly?
Yes, we can hear you 5 on 5 and we can see your slides.
Okay, thank you. So shall I start?
Sure, when you're ready.
Thank you. So thank you, Samuel. Thank you for the kind introduction. And before I begin my talk, I would like to thank Professor Edegisola and the entire organizing team of the TORG conference for inviting me to this wonderful academic meet. It's indeed my pleasure and an honor to be a part of this conference. And I would also like to thank the organizers for giving me an adequate time of 20 to 25 minutes, which will allow me to actually delve in depth about the topic, which I believe is very relevant to all medical professionals. So I have been asked to talk about the topic of the role of AI in robotic surgery, and that is exactly what I'm going to do now. So as we are all aware, being meant to do a very small step in the surgery, for example, taking neurosurgical biopsies or assisting in a TRP procedures, things actually took off in the year 2000 when the Intuitive Surgicals got the FDA approval for their Da Vinci system. And this has actually revolutionized the entire surgical field from from the year 2018 to 2012 to 2018 onwards. There was seen a more than 700% increase in the use of robotic surgery for general surgical purposes. And this proves the rapid adoption of this technology worldwide. And for the last couple of years, starting from 2020 onwards, we are seeing a massive integration of the artificial intelligence into the robotic systems. But in fact, even after 25 years of its introduction, robotic surgery is still primarily a master slave relationship, where a human surgeon performs all the surgical procedures sitting at a operating console, and these movements are actually just replicated by the robotic arms. So robot cannot actually autonomously do anything without having the input from a human operator. But with the advent of artificial intelligence in robotic surgery, all this and in fact much more is going to change in the near future. But as things stands today, the robotic systems only have this level one autonomy, though slowly and slowly we are moving to the next level of this. So since the talk is about the role of artificial intelligence in robotic surgery, we as medical professionals should understand what AI actually is. There is a lot of hype about AI in the recent times, and there are lots of myths, there are lots of fictions, and there are some facts also. So my job today would be to filter away all the myths and the fictions related to AI and its use in robotic surgery, and to present to you some facts. But starting, first of all, we as medical professionals should understand what actually AI is and what is our current level of awareness. So this is a very interesting data which came from IRCAD study, and which showed that almost 75% of the surgeons were unaware of the fundamental concepts of artificial intelligence. Around 15 to 16% of them were having some awareness, and they actually were afraid that it is going to change their job as a surgeon or may entirely replace a surgeon in the near future. Well, this is again one of the myths. Knowledge is power. To understand and to benefit from AI, we should first understand what it is. So I'm just going to take the next couple of minutes to familiarize ourselves what actually AI is all about. So AI is nothing but the study and the development of algorithms that give machines the ability to reason and perform cognitive functions such as problem solving and decision making. So AI is actually the result of numerous numerical calculations which are done by the computer to create a form of intelligence which mimics human cognitive functions. There are four pillars or four important aspects to AI. And these are machine learning, deep learning, computer vision, and the natural language processing. So without going into the technicalities, just emphasizing what is relevant to us as medical professionals, we should understand that machine learning is basically the ability of the machines to learn and make predictions by recognizing patterns. So what this basically means is that if I show hundreds and hundreds of images of, for example, a cat to a AI system, then slowly and slowly the system starts to recognize this. Yes, this is what a cat looks like. Something similar is being done in our surgical field also. If we can show hundreds and thousands of images of a difficult gallbladder to the computer systems, slowly and slowly they start recognizing the patterns. And thus they can help predict the surgical outcome and the possibility of the complications of a particular case of lap polycystectomy. And not only that, there is an adaptive improvement going on over time by learning from the surgical in these patterns. The next aspect is deep learning, which is slightly different from machine learning. So in contrast to machine learning, where we had to use and use a set number of traits and images, and it required us to upload those images to the computer systems. Deep learning is working by the use of artificial neural networks, which are inspired by our human nervous system and can be trained to learn on its own. In fact, right now, while this talk is going on and during our session, at present at John Hopkins, the surgical robots are learning by watching surgical videos as if they are just medical students. And this eliminates the need to program each and every detail of the surgery for the computer. This has wide range applications, ranging from image processing, image segmentation, a little bit of what I'm going to talk about in the next few slides. But this enables us to detect lesions in our CT scans and MRIs to create some differential diagnosis and also give us real-time guidance during surgeries. The next component is computer vision, which again has a lot of applications in robotic surgery, from 3D mapping of the surgical sites, enhancing the overall situational awareness of the surgeon, identification of anatomical landmarks, and thus increasing the precision and the safety of the operative procedure. The last component of which is relevant to us is natural language processing. This basically means the computer's ability to understand our own human language, which we use in our day-to-day conversations. But to achieve this human level understanding of our language, NLP systems must go beyond recognizing the key words. For example, not just understanding what a cholecystectomy or a hernioplasty means, but we actually be able to understand the written notes. And so NLP enables the artificial intelligence to infer the meaning and the sentiments from these written notes. They could be in the form of progress notes or the OR notes or simply the written history of the patient. AI can go through all that and understand the meaning. So again, this has wide range of applications. It allows the clinicians to write more naturally and enables the computers to understand the information. And as far as the surgical patients are concerned, NLP can automatically identify the words and the phases in the OT notes and the progress notes, and thus even predict the possibility of an impending anastomotic leak or a bleed or any such complication from happening. So, how is the integration of AI into robotic system happening? Well, surgical robots, they rely on data which is gathered through the sensors and images as we operate and use them. And a huge amount of data is generated and captured during surgery. This could be in the form of the preoperative CT scans or MRI images, from the ambient cameras which are installed in our OTs, or even from the laparoscopic cameras, and the vital signs monitoring from the monitors is also a kind of data which is fed for the AI. And AI basically feeds on all this data. And this is the key behind the integration of AI in robotic surgery. So the use of AI in surgery has evolved from very basic imaging and very basic techniques to present day robotic systems which are capable of real-time surgical guidance and a little bit of autonomous decision making also. So how exactly is it going to benefit us? Well, AI has its own set of advantages. Robotic surgeries, robotic systems, they have their own strengths. And when we bring the two together, the advantages are being in the form are going to be in the form of surgical planning, better instrument control, better real-time assistance and feedback, and overall optimization of the surgical procedures. Now, coming on to the current applications of AI in robotic surgery. So AI's role in robotic surgery is not only during the procedure, but it starts much before that. AI is playing a role in the preoperative, intraoperative, as well as the postoperative phase of treatment. Now, as far as the preoperative role of AI is concerned, it is being used for image segmentation, it is used for patient selection and risk stratification, it is used for something which is known as predictive analysis of the surgical outcomes, which I'm going to explain in a minute. And it also helps in workflow optimization and the scheduling of the patient cases in the OR. There's a long list of intraoperative applications, which I'll again discuss in a little bit. And there are post-operative role applications of AI also. So let's start with the preoperative phase of the surgery and how does AI help us in image segmentation? Well, AI enables high precision image segmentation to support preoperative planning in robotic surgery. So what this means is it can help us identify and outline the anatomical structures which are seen in a CT or a MRI scan. It allows us to do a 3D anatomical reconstruction of the organs as well as the lesions, and thus facilitates the surgeon to plan his approach and the overall surgical mapping. Just to give you an idea, this is what the AI is doing here. It can segment each slice of the CT MRI scan along its three axes, the sagittal, the coronal, and the axial axis, and separately into different tissues and organs, and then recreate a three-dimensional image for us. So this will explain it a little bit further. As we can see here, this is a video showing images of a CT scan, and the AI is doing its job and actually giving us a 3D model. It is generating a 3D model of not only the normal anatomy, but is also superimposing the images of the pathology over the normal anatomy. And this definitely helps us in planning our approach when we are going to operate upon that patient. Another small demo video which will help you understand how technology is helping surgeons nowadays. So this is a surgeon who is actually bringing up all the CT scan images, and at any particular slice, any particular image which he chooses to analyze, the AI can actually create a 3D model of that part of the anatomy, which the surgeon can rotate around, can magnify, and poke around so as to plan what would be the best approach to reach the target of surgery in any given scenario here. So basically what it helps us is it enables the surgeon to plan the optimal approach even before the surgery has begun. So as you can see here, the surgeon is first studying a 3D reconstruction of the anatomy, and slice by slice, centimeter by centimeter, he can analyze that entire area. And not only that, the surgeon can actually take that image and superimpose that image on a human mannequin so as to actually have a very reliable idea as to how or what would be the best approach for this particular procedure. So this is all being done with the use of AI. Moving on to the next role. So this is regarding the use of AI in patient selection and risk stratification. AI helps in patient selection for robotic surgery by analyzing the complex data sets of the patient, including the electronic medical records, the lab results of the patient, the images from the CT scans and MRIs, and even the genetic makeup of the patient. So the key applications of this is in the form of, to predict the surgical risks and the outcomes and to identify ideal candidates for the surgery based on the various comorbidities, age, BMIs, and other surgical history which is relevant. This ultimately results in optimized OR scheduling and resource utilization and better patient outcomes through tailored interventions. The next aspect of AI in the preoperative phase is what we call as the predictive analysis of surgical outcomes. Again, AI has the ability to analyze large volume of patient data and the procedural data, and based on that, it can actually predict the possibility of the post-operative complications and what would be the post-operative hospital stay and what would be the recovery trajectory of this particular patient be. Based on that, it helps us in decision making for personalized care of the patient and thus enhances the surgical planning and data driven insights, reduces the complication rates, and again optimizes the resource allocation and post operative care pathways. Workflow optimization, and the OR scheduling has always been a challenge for all OT staff. How many patients to post in a particular day and how to get all the surgeries which are planned for that particular day to be done. We are all struggling with our resources and the time. And this is a very interesting study about the role of AI in the OR management published in 2024, which, it reviews the highlights. This basically highlights the role of machine learning in predicting the surgical case durations, the optimizing of the resource allocation, and detecting the surgical case cancellations. And it showed that AI models demonstrated potential to significantly enhance the efficiency, the cost effectiveness, and the overall safety of the surgical procedures. So AI basically helps us in optimization of our OR schedules and thus reduces the delays and the any ideal waiting time which we all struggle to cut short. Now coming on to the current intraoperative applications of AI in robotic surgery. So AI broadly contributes in two ways as far as intraoperative functioning is concerned. It helps to augment the surgical experience. And secondly, it expands the capability of the surgical robots and tries to make them a little bit more autonomous. And each of these categories focuses on creating the safe, data-informed surgical decision making. Let's talk about the first application, which is real-time anatomy recognition. AI-driven real-time image enhancement allows for enhanced identification and anatomical structures during the robotic surgery. So what it means is basically it is like a very reliable second surgeon working next to the operating surgeon, helping the primary surgeon identify and understand the anatomy which is usually distorted when there is a disease. Not only that, it also helps in real-time labeling of the organs. It provides a visual overlay to avoid critical structures and supports decision making during the dissection and resection. So as you can see, these are augmented reality images which are being live superimposed during a surgical procedures and help the surgeons to identify where exactly that lesion is, what are the vital structures which are situated next to it and should be avoided. So AI also, superimposes the CT scan and MRI images onto the live feed for enhanced orientation of the surgeons, and thus helps in identifying the tumor margins, vessels, nerves during the procedures. What it basically helps the surgeon in doing is it guides not only the incisions and the dissection planes, but it also helps in improving the depth perception and the surgical accuracy of the surgeon, and thus helps us achieve more of R0 resections. This is just an example of augmented reality working during a robotic surgery. So as we can see, the surgeon on is sitting on the console and operating can get this 3D virtual models which are constructed from the medical images, and they are being superimposed directly on the surgeon's field of view, which the surgeon can see via wearing a AR headset, and thus helps them understand and perform a surgery in a safer and a more precise manner. Another example of the augmented reality overlays. This is a surgeon who is trying to do a percutaneous aspiration biopsy for a lesion in the liver. And rather than being guided only by a ultrasound image, here we are making use of the artificial intelligence to create and project the augmented reality of the anatomy right there on the screen. The surgeon can see not only the abdominal wall, but the underlying organs, the various structures adjoining to the lesion. Another example of augmented reality is seen here. Wearing the AR headsets, the surgeons can actually see this 3D constructed model of the vascular anatomy and the vital structures in the area of their surgery, and thus discuss among themselves. So whoever in the OT is wearing the AR headset right now would be seeing something, but the others, these are basically just surgeons who are doing some choreographic movements. So the surgeons are basically looking at a virtual image and can see it in 3 dimensions, rotate it, and so as to plan what would be the best approach and what is the surgical approach going to be here. So we can all appreciate how beneficial this is going to be for surgeon once he's sitting on the console and starts operating upon that area. So that image is being superimposed upon the screen, which is showing the actual surgery being done. So moving on, the third role of AI during surgery is intraoperative decision support. So AI can assist the robotic surgeon by providing real-time analysis and guidance. And the key applications are in the form of intraoperative interpretation to suggest the next surgical step and warns against a deviation from safe anatomical zones. So this enhances the overall situational awareness and reduces the cognitive load on the operating surgeon. On a real-time basis, it brings down the risks of complications by giving alerts to the surgeons and augments the surgeon's judgment and intraoperative decision-making accuracy. This is an example. This is a study which was conducted jointly between NVIDIA and the IRCAD France. So on one screen on the left side, you will just see a simple laparoscopic or a robotic image of a lap poly being done. But on the adjoining screen, the AI is actually highlighting the areas and identifying the various anatomical landmarks and guiding the surgeon to understand the anatomy and suggest what would be the right structure, which is the artery in this particular case, which should be clipped and where exactly should it be clipped. So this definitely enhances the overall confidence of the surgeon, making the surgeries more reliable and safer. Another example is this. This is an interesting study by the Madani group, which was published in 2022 of the Annals of Surgery. And what they did was they used AI for intraoperative guidance and using segmentation to identify surgical anatomy during a lap poly. So all the safe areas during this surgery were highlighted by green, and AI is doing this, and all the no-go zones, the area below the rubeus sulcus, the area of the CBD, which a surgeon should ideally stay away from, are all being highlighted by this red color here. So this can actually help a novice, a beginner surgeon, as well as a senior surgeon when the anatomy is difficult. So another example of intraoperative decision support is now that we are using AI-enabled staplers. So whenever we are planning to fire a stapler over the bowel, so what should be the pressure which is being exerted onto the tissue? What is the angle or the alignment of the stapler correct? All these, the AI is now looking into it and giving a real-time feedback. So as you can see here, this is an AI-enabled stapler, which is first being applied to create a sleeve. So the AI is giving a real-time feedback. What is the pressure being, the tissue is being subjected to? What is the correct time for compression of the tissue? And then the AI gives a command and fires this stapler, making it much more reliable and safer. So this is something which any surgeon would love to have. Now this is basically the AI working here and on the console telling the surgeon not only the force which the tissue is being subjected to, but the safe dissection planes. It is suggesting what could be a positive margin while the resection of a malignancy, and it is suggesting what should be the safe and the correct plane where the surgeon should be excising the tissue. So this is actually going to help a lot in achieving R2 resections, something which is very, very vital for all of us. The next important aspect of the role of AI is that it is working big time in instrument tracking and collision avoidance. AI can now track the real-time position and the movements of the robotic arms, and it can detect a potential collision of the instrument from happening and thus guide the surgeon. So this is again something which is very, very important for any robotic surgeon and also for the safety of the robotic system. The something similar to instrument guidance is motion scaling, tremor filtration, and the force feedback. The key applications of these functions are that the robot filters out all our physiological tremors, which are natural when we're doing a fine job. It also helps in motion scaling. It scales down the surgeon's large hand movements into fine robotic actions, and thus it gives greater surgical precision and thinness to the procedure, to the surgery, and reduces the tissue trauma. So this is just a small demo video to actually make us realize how precise the movements are now becoming. So this is a operating surgical robot which is working on one single kernel of a corn, just giving a very, very superficial skin incision, and then the suturing is being done. So we can all appreciate the kind of finesse which is required for these kind of procedures and which can be achieved with the use of a robotic system now. So this is the kind of capabilities which the robotic systems and AI-enabled robotic systems have enabled us, and they are strengthening the capabilities of the surgeon to do this fine kind of jobs. So now there's a micro scissor coming in and cutting. So in spite of lack of a direct tactile feedback, AI can now enable a very, very fine and a precise movement to using the robotic surgery. So I shall move on to the next slide and the next role of AI. So autonomous suturing algorithms are now being introduced, and they're just getting better and better by the day. And the key applications of this are going to be in the form of, the computer or the robotic system guiding the surgeon to control the needle angles and the needle placement, and thus ensure a very consistent tension on the tissue and spacing during the suturing. So this overall reduces the operating time and the surgeon's fatigue. It enhances the consistency and the quality of the sutures and improves the patient safety and healing outcomes. This is an example of a robotic system which is now has gained or achieved partial autonomy. All the surgeon is doing here is basically feeding the suture or following up, and it is the actual robotic instrument which is doing the suturing. So the roles are sort of going to be reversed in the near future. Now the surgeon is actually acting like an assistant to the robotic arm, which is doing this very, very precise and well spaced suturing of the tissue. The next role of AI is in improving the overall intraoperative safety. So AI plays a very important role in enhancing the safety during a surgery by continuously monitoring the critical parameters of the patient. So it can immediately alert the surgeon about deviation from the normal physiological or surgical parameters in real time, and thus alert the surgeons to a possible instrument malfunction, tissue injury, and uses these predictive models to anticipate any adverse events even before they occur. This is again something which is going to improve the overall safety of the surgery. Talking about the role of AI in the post-operative procedure. So the first application is in post-operative complication prediction. So what this means is basically that AI can enhance the post-operative care by predicting the possibility of the complications before they even happen here. And the second role is in the form of surgical video analysis for quality improvement. AI can evaluate the surgeon's skills by tracking the precision, the speed, and the technique of the steps during the surgery and provide a personalized feedback to the surgeon, and thus helps in getting better and better. It also has a role in the training and the simulation. This is a AI enhanced training platform where the surgeon can actually practice without the need of learning on the patients. So they can learn from the expert techniques and repeatedly practice the challenging steps which they anticipate during the surgery by working or using these AI enhanced platforms. And you can see here, not only just picking the rings and placing them back, but holding the correct needle, practicing your hand movements as you plan to use them in a particular scenario. This really comes as a big boon for all the surgeons who are into complex oncological and radical procedures. So, and gives them a lot of opportunity to practice rather than straight away stepping into the surgery. So for the lack of time, I think I'll move ahead a little bit. So although AI is proving to be a big boon for all the surgeon and the medical professionals, there are certain challenges and ethical considerations which we must look into. Issues related to the privacy of the patient's data, the reliability and the accountability, and the training needs of the surgeon, and obviously the cost which it involves. So data privacy is a very important aspect which we must all look into. AI is data hungry, and developing these machine learning models for robotic surgery requires a large number of surgical videos, instrument kinematics, and surgical biometrics. This requires large-scale data sharing across multiple institutions, and thus data privacy becomes a major concern. So we must use standardized ways to anonymize all the data which is collected from the patients and the surgeons, and this is very critical for the privacy point of view. Model transparency is a must in the operating room. The reliability and the reproducibility of the AI algorithms are of top importance. Unfortunately, most is actually this is the latest development from the field of AI in robotic surgery. We were talking about the level of autonomy, and here we have a robotic system which has shown the capability to independently and autonomously perform a laparoscopic cholecystectomy, obviously in a porcelain gallbladder. And this was reported from the John Hopkins University, and this is the SRTH model of the Da Vinci system, which has shown the capability and taken the autonomy of the robotic system to the next levels. So to conclude my talk, I would like to make or highlight these points. AI is actually revolutionizing robotic surgery by enhancing the precision, safety, and the outcomes. But AI in surgery isn't a scientific fiction anymore. It's actually a science fact now. And together we can ensure its promises is fully realized. So while challenges exist, the benefits are going to be transformative, and technology is not about replacing the surgeon or the healer. It is actually about empowering the healer to see further, act faster, and care deeper. So let's embrace AI responsibility to deliver better healthcare. Thank you. And I'll be happy to take any questions.
Thank you so much, Professor Bhalla, for that excellent presentation. If you have any questions, please feel free to drop them in the chat box or to raise your hand. While you were presenting, someone asked if the AI robot is capable of identifying the normal tissue and suture it. I think that's when you were talking about the surgeon assisting the robot. He was asking if the robot is able of identifying the normal tissue or the tissue it is supposed to suture.
Yeah, I think I addressed that point. The AI is nowadays capable of giving us a real-time anatomical feedback, not only of the normal structures, but also about the lesions, and creating a 3D model of that entire area where the surgeon is working, and actually projecting that model onto the field of surgery.
Oh. Oh, thank you very much. I have a question that's going to be the last question because we're running out of time. It is often said that the AI models existing as of now are not very applicable in low and middle income countries because the data used to train these models are from high income countries. So, if we were to stop complaining about this and maybe start acting, what would be the immediate first steps towards building and implementing AI in low and middle income countries? Should we start with creating databases, training healthcare workers? What do you think will be the first steps in implementing artificial intelligence in surgical care in LMICs?
Yeah, so this is basically the issue of bias in AI, because and if most of the training videos are coming from one particular part of the world, you know, the AI, the models which are being developed, which are being trained using those videos, may not be entirely accurate and may have a bias if they are using in some other part of the world. And that is one of the issues which I highlighted, which needs to be addressed, that the whatever AI models are being generated should be universal and global in application. There, the bias, if any at all, is there in these AI models has to be rooted out. Only then they will have a, the global utility. And once the AI models, I do agree that the cost is definitely high right now. But once the models are perfected, as with every technology, the cost is definitely going to come down.
Hey, thank you very much, Professor Bala, for that amazing answer. So we have a last question
Sure.
from Zakir Hussein. He's asking, do you think AI-based robotic platforms will shorten the learning curve for surgeons or risk de-skilling them if they rely too much on automation?
That is actually one of the biggest advantage of these AI models. And most of the robotic systems are actually now integrating a training module within their robotic system itself. So the surgeon or the trainee doesn't have to learn on the patient anymore. The days of learning by operating on the patients are actually over. That is where we now have simulators and AI modules to train our surgical